name is Barbara O'Rourke, and I would like to talk to you about dense breasts. According to the National Cancer Institute, screening mammograms can miss out about 20% of breast cancers that are present at the time of screening on women who have dense breasts. High breast density means that there is a greater amount of breast and connective tissue compared to fat. I am a woman with dense breasts. In 2002, 2012, and 2015, when I went to get my normal yearly mammogram, I was notified that I had a large amount of calcifications in my left and right breasts. Calcifications are tiny bits of calcium deposits that may be an early sign of breast cancer, although not always. The pattern of calcification in a woman's breast tissue helps a radiologist decide whether breast cancer could be present. I was sent to a cancer center for a magnified shot of my breast tissue. Each time I had a suspicious mammogram, the cancer center would have me come back every 6 months for a diagnostic mammogram. Until finally, after 2 years, they decided they wanted me to do a core needle biopsy. A core needle biopsy is a hollow needle that is used to withdraw small cylinders or cores of tissue from the abnormal area in the breast. For 2 years after each diagnostic watch, both my husband and I worried, suffered undue anxiety, and undue costs of the test. I also suffered loss of time from work and a lot of physical discomfort. There is a need for women to know what type of breast tissue they have. According to the National Cancer Institute, the benefits of mammograms need to be balanced against the harms. Some of the possible harms for women with dense breasts are false positives, results, costs of overdiagnosis and overtreatment, and radiation exposure. Let's look at false positives. Costs involved for diagnostic mammograms and unnecessary radiation for women. False positive results occur when a radiologist decides the mammogram is abnormal but no cancer is actually present. These results are more common for younger women, women who have had previous breast biopsies, women with a family history of breast cancer, or women who are taking estrogen. If a woman is found with dense breasts, the breast center should notify them and study the patient's history to see if they have any common possible reasons for the abnormal mammogram. Offer the woman her medical records and suggest getting a second opinion before she has any invasive procedures done on her breasts. When a woman goes for her first mammogram, she should be counseled about lifestyle changes that may benefit her in the future. A study from the University of California, San Francisco revealed during a decade of receiving mammograms, more than half of cancer-free women will be among those summoned back for more testing because of false positive results, and 1 in 12 will be referred for a biopsy. Women can incur the estimated cost of $574 for each diagnostic breast mammogram. This includes the doctor, radiologist reading the x-ray, and the cost of the diagnostic mammogram itself. After 2 years, or when the radiologist determines it is necessary, a core needle biopsy will be ordered at the price of $5,518. This figure is from Aetna Insurance Company and includes the physician, the surgery suite, the pathologist, and the radiologist that must be present to read the test, all to support a false positive. If the doctor thought there was a problem, perhaps doing the needle core biopsy after the first abnormal mammogram would have been prudent. This would save the woman and her family needless worry, loss of work time, and the needless physical aggravation of having your breast bruised after each diagnostic mammogram. According to Dr. Samuel Epstein, one of the world's top cancer experts, the routine practice of taking 2 films annually for each breast results in approximately 0.5 rad, radiation absorbed dose, exposure. This is about 500 times the dose from a single chest x-ray and is broadly focused on the entire chest rather than narrowly on the breast. This is also about 25 times higher than is allowed by the Environmental Protection Agency for whole body radiation from local nuclear industries. That reading is 0.02 rad. Moreover, the breast is the most sensitive organ to ionizing radiation. Mammogram also compresses your breast tightly, which can lead to a dangerous spread of cancer cells should they exist. What can we do to change our thoughts about breast health? My solution is to educate girls in school about breast cancer and how a few healthy lifestyle changes at an early age could possibly change their future breast health. If someone has dense breasts, the breast center should notify them and offer counseling on lifestyle changes. What can we do now and in the future? In the future, I can see using other tests besides mammograms for an early breast diagnosis. But as a society, we can work on preventing some cancers from growing in our body by lifestyle changes. Some of these changes are avoiding sugar and processed food, optimizing your vitamin D levels, limiting your protein, and avoiding unfermented soy products. How much time would it take to educate our children in school and women at a breast center? Certainly not as much time and worry as it takes to continually expose women to tests that are not accurate. When you leave today, I hope you will be motivated to read and educate yourself about dense breasts. Find out if you have them and if you are in the risk zone. Get advice on positive lifestyle changes that may keep you from unnecessary worry about false positive, expense of multiple doctor visits and tests, and unnecessary radiation exposure. Thank you for your time this evening.